Hey everybody, this is Shanti coming to you with another video here on my channel with Shanti J Speaks. Today I want to talk about IUIs when it comes to getting it done in the clinic. So just check me out, hit the like, share, and subscribe button so you can get every one of my videos going forward. Today I want to talk about this IUI thing. So a lot of people get it messed up about the IUI procedure. This is either done by a nurse or a doctor in the office, and it is done with a set of sperm that is produced either by a sperm donor or the spouse or the partner of the person. So everybody just thinks that the person just goes in and produces sperm. The sperm, you know, it just goes into the lady a different way through a catheter and then it's done. No, it is a lot of work. So we're going to start with the sperm first. So the man first has to produce the sperm. And he can either do this at home, but he has to bring it in within the hour because it has to stay warm, because if it gets cold, it's going to pretty much dry up. And it cannot be used at all, and he will have to produce another sample. So most men like to produce at the office or at the clinic just because it's fresh, and they can get the semen in right away, and they can begin to analyze it. And this is what they call a semen analysis. What they do is go in and they wash the sperm, basically, and I'm trying to keep it in terms that I can relate to the general public. But they wash the sperm, which is amazing. They take out all of the sperm that is deformed, 2 heads, 2 tails, not moving, dead, and they give you the best swimming sperm and the best mobile sperm that are doing what they're supposed to do as far as swimming right and all of that. And that is what they use to insert into the woman who is also on a timed ovulation. This is not just done all willy-nilly. They have her on a timed ovulation, which they are anticipating the egg to drop. Some people or some women have to be put on medication, and then it has to be a timed ovulation. And with that timed ovulation, they try to time it just right so they can have the sperm be inserted through a catheter, and it can hopefully meet the egg and in turn fertilize and be able to implant itself in the uterus just in time before her next cycle. When it comes to like a person who doesn't have to use medication and they're using a normal cycle, then they will do the same thing. The only thing is they will time it based off of the cycle itself, the period. And so based off the period, when they expect the egg to, the person to ovulate, they will then set up an IUI procedure so that the sperm can hopefully meet that egg, and then that egg can fertilize and do the same thing as implanting into the uterus. Now, everybody who gets this done, they always have the 2-week wait. And I just want to stress that the 2-week wait, whether you take a million tests, whether you don't, it's still going to come out to be the same result. So I suggest that you don't take any tests, that you relax, that you calm down, that you do relaxing things, read you a book, eat you some fruit, sit down, watch TV, watch movies, be with your family. Just relax, because there's no sense of you like worrying about it, because if it's going to happen, it's going to happen, right? And if it's not, it's not, right? So even if you get to the end of the 2-week wait and it didn't happen, you worried all that time for it not to happen. And even if you do get to the end of it and we anticipate it for it to happen, I mean, you still have to wait the 2-week wait, but why worry and why put that stress on your body? Either way, don't worry about the 2-week wait. Act as if nothing is going on. You just speak, positive things over yourself. Things are growing, things are changing. I believe that this is going to work. I believe that this is going to manifest. Whatever you have to say and do to keep yourself in a positive attitude and a positive mood, you do that, okay, baby? You do that. Okay, so in the 2-week wait, a lot of people like to take a lot of tests. Like I said, they like to come in for blood tests randomly, just to come in to see if they are pregnant. And in the 2-week wait, I want to stress that even a urine test may not pick up your HCG level in the urine test in the 2-week wait, because it could be too early. Sometimes even the blood test may be very, very low, and then you can either get discouraged by checking too early, or you can get discouraged by the blood not showing up right away when it might have a late growth spurt, and it might just go towards normal numbers and shoot up the way it's supposed to. So we don't want to overdo it when it comes to the 2-week wait thing. So that's why I stress. Just relax. Moving on. After the 2-week wait, we want to see if you are pregnant, so we bring you in for a blood test. This blood test will determine where we start. If it comes out to be a positive, then we start from there. In about 3 days, we want you to come back and get another blood test, because we want the numbers to double. And so, as I stated in my previous videos, my numbers didn't quite double. and some weird things went on with my numbers. And so that's why they had a little bit of a suspicion when it came to my numbers and the ectopic pregnancy that I had. But if your numbers are normal and they are doubling, then you are pregnant, and you go on to the next phases, which is wait the next couple of weeks to you know, get your ultrasound and everything like that. We do test like a thyroid stimulating hormone, which they call a TSH, and that's just basically to make sure that that's in balance so that the baby, you know, can thrive and have everything it needs and all the hormones are in balance the way they're supposed to, so the pregnancy can go forth in a healthy way. So the IUI is not as easy as I just made it sound. I'm going to explain the actual step-by-step of what they do. So ladies, we all know that we use a gynecological examination tool known as a speculum. That's the thing that they open your woo-ha up with. And so it's either metal or plastic. So, you know, however you're going to deal with that. The best part to do right here is just to relax. The more you tense up, the harder that thing is, okay? And so, sorry. That's just like, I just hate that part. And every time I just cringe. Okay, anyway. After that, they make sure they clean your cervix off with some brown iodine soap. If you're allergic to iodine, they will use some saline water or something of that substance to clean off the cervix before they insert the catheter. When they insert the catheter, they then are going to screw on a syringe that is loaded with the sperm that was provided by your partner, and then they're going to inject it through the cervix, and the prayer is what I told you earlier. And this is going to be a little bit painful because nothing, I mean, our vaginas they don't like things going in them that are not pleasurable, and a little thin catheter can still cause pain when it comes to going through a cervix, especially if you have a cervix that is you know, lower or not just, you know, directly straight ahead. It could be, you know, curved. It could be anything as far as why you would need a doctor to do that, but most nurses do that. But if it's like a really, really hard cervix to find, then they will have the doctor do the insemination. So yeah, that is the IUI procedures that you can expect when you come. They do want to make sure that, you know, you guys are still taking your vitamins, still taking your prenatals and all of that. And I have not done that because, like I said, with me, because I have one tube, it would be almost pointless to try it if my other tube is blocked. So my next step would be for me to get a HSG procedures for me to see if my other tube is blocked. If the other tube is not blocked, I can go ahead and go forth again and try naturally one more time, and they will have to monitor me to make sure that doesn't turn into an ectopic, because I will be at a high risk, and this will be my second pregnancy. And when you have an ectopic, you just stand the risk of having another ectopic. And so they think that my cilia in my fallopian tubes is low, and that's the little hairs that basically push things along as far as the egg is concerned. And so they want to, you know, go take a look at that and see what's inside. Hopefully they can see it. I mean, it's microscopic, so I don't know if they can see or not, but I can ask that for myself. But anyway, so I have to do an HSG just to see if my tube is blocked, basically with any scar tissue or anything like that, stopping me from, you know, conceiving naturally. And if I am clear, then my doctor wants me to try again naturally whenever I'm ready to do that. And if there's another ectopic, then you know, hopefully if we can stop it, then great. But if not, if there's another rupture and we have to do another procedure, then I will be automatic candidate for IVF, because at that point I will have no more tubes left, and they will have to actually do the insemination with the sperm and my egg, combine it together, watch it grow, and then implant it directly inside of my uterus. So they want to give it one more shot before I have to go to IVF when it comes to that. And it all starts with what this HSG says. So when I do that, I will have you guys on standby. I will do a couple of videos with me being in the procedure room and everything like that before I go in. But I know they're not gonna let me actually record, because I'm going to be knocked out anyway. So but yeah, I'll record as much as I can about the procedure and everything that I have to do. And yeah, so I have to schedule it first. Pray for me. All right, until next time, guys, I'll see ya. Bye.